Hey guys, today we're going to be doing an assessment of the abdomen. So the first thing we would want to do is usually our patients, male patients would be shirtless and female patients we would rise their shirt up so we could assess the skin of the abdomen. We just want to look and make sure there's no type of lesions, maybe some noticeable masses or anything like that. Once we assess the skin, we will inspect the contour, the symmetry of the abdomen, the umbilicus, and any pulsations in the abdomen. For really thin people, we can usually, when they lay flat, you can actually see the pulsation of the aorta right here. It's just like a mild pulsation, and that's normal. Next, after our patient has been lied flat and we've assessed their skin, um, maybe even the pattern of their hair or anything like that, we want to listen for bowel sounds. It's really important that we do this because absent bowel sounds can be a really big deal. So, and those are good. Just want to hear some active bowel sounds like a gurgling noise is normal. Next, we want to look at the vascular sounds. This includes the aorta, the renal arteries, the iliac arteries, and the femoral arteries. After your patient has been lied flat, and the femoral arteries are bilaterally at the right here, the almost in the inguinal area. Next, we want to percuss the abdomen. Tympani and dullness is very normal for the abdomen, that sound. Sounds good. No tenderness. Next, after that, after the patient's still lying flat, we want to measure the liver span, and that's at the right midclavicular line. And sometimes, obviously, the patient will be lying flat, but you would palpate right here, and then you can usually palpate the edge of the liver, but sometimes it is not palpable, and that's normal. After we palpated the liver, we want to percuss the splenic dullness as well and locate the spleen. This is at the left axillary line, so right in this region. And again, sometimes you can't palpate the spleen, and that's normal. If you can palpate the spleen, that could lead, maybe the patient has some type of infection or the spleen, could be inflamed. So something to look at. Next, you just want to do a light palpation, and we're going to go clockwise. So we'll start here, just using 3 fingers, light palpation. Just noting any tenderness or any rebound guarding is something important we want to look for. Next, we want to do the deep palpation. As we're doing this too, when we palpate a patient's abdomen, we want to look at their facial expressions. Maybe they're not going to say it hurts, but we can kind of look and see if their facial expressions change. We're just going to do a deeper palpation. Again, going clockwise. Next, after we do the deep palpation, we want to palpate the edge of the liver like we did earlier. And the patient would inhale, he would hold his breath, and see if we can palpate just the edge of the liver. If you can, that's okay, but if you can't, that's normal. Next, we want to do the spleen. The patient will be lying flat. We'll ask him to inhale. We'll palpate and see if we can feel the spleen with kind of a deep palpation. And if you can't feel it, that's normal. Next, you want to palpate the kidneys. Um, the the one that we can palpate usually is only the right, and sometimes that's not even, you still can't even feel it. But next, we want to look at the aorta pulsations. We would do this. The patient would be lying flat again. We would feel right here bilateral hand movement and kind of feel for any pulsations from the aorta and the abdomen. After we've done that and all that checks out normal, if indicated, we would assess the abdominal reflexes. You can do this by getting some type of, nothing sharp, but something that would just kind of cross over like this to see if there's any type of reflex in the abdomen. And next you want to assess the inguinal area. You would ask the patient to pull down their pants a little bit so you could assess the skin. You want to palpate the femoral pulse, and you would do this bilaterally in the inguinal area right here. It's really important to know any type of, the skin, if there's any redness or just anything that, could be, look abnormal. Just want to make sure that the skin checks out great too. I believe that's it.